Hi, welcome back. In the last episode, the patient mentioned having some problems with his ear. He felt that his hearing was declining and could occasionally hear sharp, high-pitched noises. In this episode, Dr. Huai Seng conducts some hearing tests on the patient to figure out the issue.
Okay, with the tuning fork, and also I will later put in a scope into your ear to have a look. Would that be okay with you?
Yeah, doctor.
Can, huh? Alright. So first of all, I'm just going to look at your ear first. Huh? Please look to the front.
Okay, doctor.
Okay. I'm just going to say something. Please repeat after me.
Sure.
I'll be standing behind you. Would that be okay?
Okay.
Alright, huh? Okay. 52,
52,
47,
Dr. Huai Seng is Consultant Family Medicine Specialist and Clinical Associate Professor at NewMed. He is involved in the teaching and assessment of medical students from years 3 to 5. In addition to being the lead for the MBBS Year 3 Integrated Core Clinical Placement Primary Care Module and Transition to Clinically Based Learning Module.
Follow the instruction and see whether you can hear clearly or not. Alright?
Okay, doctor.
Okay, so I will check your left ear first.
Okay.
Can you feel the vibration?
Yes, doctor. I can feel.
Yeah. Please tell me when a vibration is over.
Yeah, doctor, it stops.
Can you still hear?
Yes, I can still hear it.
This test is called the RINA test. The test differentiates sound transmission via air conduction from sound transmission via bone conduction. It can serve as a quick screen for conductive hearing loss. If the result of the test for bone conduction is better than air conduction, this means the patient cannot hear sound conducted through the air after the fork is moved from the mastoid process.
Can you tell me, is it in the center or is it clearer on the left or right?
Actually, it's clear on the right.
It's more like over here, yeah?
Yeah.
Right now? Okay, thank you. Now I'm going to use this scope and put it into your ear and have a look and see what's going on inside. Okay?
Okay.
Right now.
The test that Dr. Low just conducted is called the Weber test. This test is mainly used to establish a diagnosis in patients with unilateral hearing loss to distinguish between conductive and sensorineural hearing loss. If a patient has a unilateral conductive hearing loss, the tuning fork sound will be heard louder in the deaf ear. If a patient has a unilateral sensorineural hearing loss, the tuning fork sound will be heard louder in the normal ear. The doctor will combine the results from the RINA test and Weber test to determine the type of hearing loss a patient has.
Okay, alright. I actually see some fluid in your right side of the ear, behind your tympanic membrane. Okay, your tympanic membrane is intact, but then, there's no hole, but then I could see like fluid behind it. I think that's the reason why you are not hearing clearly. Okay, yeah, but later we will discuss the some of the treatment that we can offer you for this condition. Would that be okay with you?
Yeah, that's
Alright,
okay.
yeah?
In the next episode, Dr. Low will give the patient some advice and solutions. Stay tuned.